Thank you very much, learned master of the ceremony, esteemed registrar of the university and my colleague, respected Dr. Babaji Ghevde, Dean of JNMC and CEO Hospitals, learned Dr. Sandeep Srivastav, OSD of the ABRH Hospital, learned Shri Uday Meghe, CMS of the hospital, Dr. Mahakarkar, Director Public Health, Dr. Abhay Mude, Dr. George Fernandez. I join all the previous speakers on this great occasion of inauguration of the specialty clinic pertaining to diabetes under the aegis of our super specialty hospital, which rightly put in by Dr. Sandeep Srivastav that it's a dream come true. And therefore, I would like to compliment to begin with Shri Sagarji Meghe for taking this initiative. Dreams, only if seen and are not backed with concrete action, they turn out to be hollow and absolutely fizzle out as non-entities. It's the stringent commitment that Shri Sagarji Meghe espoused in terms of the vision contemplated by his father and Honorable Chancellor of the University, Shri Dattaji Meghe, that among the series of manifestations which are absolutely the apostles and milestones of service-based creativity, today's day turn out to be a yet another feather in that illustrious cap, and therefore he needs to be complimented for the same. I would be failing in my duty if I do not compliment Dr. Sandeep Srivastav, Dr. Uday Meghe, and especially my esteemed brother, Dr. George Fernandez, to be carving out this dream and giving it such a subtle shape. Dr. Shilpa and her entire team of eminent doctors goes without saying that they definitely have created an absolutely homogeneous conglomerate of eminence and substance alike, which will turn out to be one of the cornerstones for the emerging success of this diabetic center or clinic, a specialty clinic that is being inaugurated today. Ladies and gentlemen, at the cost of repetition, other than the entire service depiction which has been put across so candidly by Dr. Sandeep, Dr. Uday Meghe, by Dr. Shilpa Gaidane, and also erudite registrar Dr. Babaji Ghevde, we always need to remember that we are a teaching institution, where how exactly the best utility can be worked out for the augmentation of teaching, training, learning, transformation of the precious human resource into a very ebullient, elegant, effective, trained health manpower of consequence and relevance turns out to be another touchstone on which our use and utility will be tested. And therefore, I'm sure that the specialty clinic, just as it will be a harbinger of the holistic services under one roof in a very elegant, ebullient, and a decisive manner, its academic use and utilization would be equally effective, would be equally meaningful, would be equally focused, would be equally poignantly worked out, and and at the end would equally turn out to be fructifying on that count as well. I'm wanting to add yet another dimension, ladies and gentlemen, which I have been emphasizing more often than not in n number of my discourses, which I try to put across with all eminent people like you. We have a huge data, clinical data. And the fact of the story is, perhaps the demographic situation and the prevailing conditions are such that we have got a double disease burden, which we are required to be sustaining. And therefore, this double disease burden, on good number of occasions, keeps all the planners absolutely in a limbo as far as working out their priorities of giving preferences and predilections to what arena of indulgence and operation. A developing country like ours, where even health, hygiene, sanitation, potable water is an issue, whether lifestyle disorders ultimately turn out to be a priority for care out of the public funding turns out to be $1 million question. The fact of the story is that a developing world which is required to cater to the domain of communicable and non-communicable diseases as well has to equally sustain the brunt of disease burden of lifestyle disorders. And therefore, in spite of the scanty resources, in spite of the glaring iniquities, the nature of onus and responsibility which is put on turns out to be very huge, heavy, and gigantic. It's in that context, relevance of specialty clinic like this, catering to the holistic cause, not only in terms of the care, cure, but also catering effectively in the domain of capacity building and generation of trained health manpower, and most important, equally catering on the count of generating new and novel research, turns out to be third important cornerstone. Therefore, ladies and gentlemen, I always emphasize in a teaching hospital, we are required to be operating by a three-arm approach. Services are paramount and they have to be rendered in the most efficient and effective manner. That cannot be a compromise on it. Acceptability by the targeted population of this country. Absolutely a satisfactory survey resulting in meaningful catering of the services turns out to be the first benchmark on which we are required to be sustaining to be true. Academic use and utilization towards very genuine, meaningful capacity building, teaching, training, and orientation turns out to be the second arm and therefore the second cornerstone. But the third most important arm which I would like to emphasize is innovative research in the domain of specialty in which we are indulging. There cannot be a better avenue of a holistic, integrated, one-roof approach in case of diabetes, in terms of rendering services and also academics, to be using it as a citadel of research. Ladies and gentlemen, ultimately, the future that we contemplate, the future that we want to shape, it is not just based on, it is the present that we deal by catering of the services. The future aspects are dealt by chiseling the trained manpower. But real future is catered by providing for innovative research, which ultimately open wide doors and vistas, resulting in bringing new knowledge, which will augment the levels of care and more so radical cure. One of the important facets which all of us have to take note of a malady called diabetes is not that a greater number of population beyond all considerations is falling a prey to it. Not just because India is expected to be a global capital of diabetes in coming times. Not because just the rampant incidental prevalence that because of the lifestyle alteration, population is getting gripped into. But the most important aspect is diabetes per se is not reversible in any manner. All tall claims that have been made in that particular direction, evidence-based contours and connotations of the same are abysmally missing. And it is in that context, although insulin therapy had turned out to be one of the boon for n number of population in this country, and for that matter, the entire world, but the lecture delivered by the person who created, the person who invented, the person who made insulin, F. Banting, 100 years before, in his lecture when he was accepting the Nobel Award. I'm tempted to quote what he had said about his discovery of insulin and what he had said about diabetes itself. He very categorically said, quote, insulin, which I have tried to put across in the interest of men, mankind, and humanity, I know it for certain, is not a cure. But it is only a treatment of symptoms. How true and how right he was. And that's exactly depicted as of now. What is real interesting is the present line of modality of treatment, the present depiction that we are wanting to work out, including tiding over the complications. We don't have a mechanism whereby we have been in a position to reach even an inch pertaining to reversibility of the diabetes that sets in. In this context, I am tempted to quote the important piece of research work in the context of material reality, that ultimately it is the insulin resistance of the beta cells which is the real cause of secondary diabetes or type 2 diabetes. Is it not a fact, ladies and gentlemen? Learned as you are, various annals of research that we go through, have we not taken note of the material fact of the discovery of E. coli curd, who has identified the insulin inhibitory receptor? The identification of the insulin inhibitory receptor, the entire concept now of blocking the inceptor for that particular purpose, is it not a ray of hope that we are inching close towards working out a modality which will be in a position to go in for maybe in the near future the possibility of reversal of diabetes? The entire concept of leveraging the inceptor for the purposes of generating a required stimulus for regeneration of beta cells in the islet of Langerhans as a micro organ, is it not going to be a real fillip? Who has done this? And who is inching towards this? It is the commitment to the generation of the new knowledge by indulgence into newer innovations, perhaps is the ray of hope. It's in that context, and just at one end, we are plagued by that the diabetes is a malady which is gripping the numbers beyond imagination. Lifestyle disorders and the associated complications that it is manifesting. In a similar way, it just cannot be working out cure for the malady, but the commitment ought to be that we would like to create a world which will be without diabetes. And it is in that context, ladies and gentlemen, it is imperative that our indulgences into the forays and domains of innovative research, cutting edge research, turns out to be a hallmark. I'm sure that this center, by virtue of the eminence that it is going to be operated by virtue of the patronage that it enjoys for itself, by virtue of the commitment of the ambience that stands provided, by virtue of the work culture of the university and the entire systems under the university, including the hospital, they provide absolutely a required fillip, which definitely can act as a catalysis for prompting this arena of indulgence as well in a very meaningful manner. It's in this context, ladies and gentlemen, with great pleasure, with great joy, with great exultation, I'm pleased to participate today in this inauguration. It's not a formal ritualistic ribbon cutting ceremony. It's initiation of heralding of an era in extending qualitative services in the domain of diabetics. It is amounting to beginning of an era for absolutely availing of these specialists and this specialty situation like the one which you have created to avail for absolute incorporation and indulgence into meaningful academic training, learning, and orientation in the real domain of capacity building, which is much need of the hour, and simultaneously invocation of meaningful, absolutely cutting edge, innovative research, which will open the new doors and vistas in the context of the problem that mankind, and the humanity as a whole is facing. I'm sure the tripartite approach and the tripartite commitment in terms of its realistic manifestation will definitely pave a way whereby this center and this clinic will turn out to be a real foundry of this Trinity. And significance of Trinity in the Indian context is paramount, ladies and gentlemen. The most pious, the most pure, and the most holiest things get generated out of a Trinity, which in our own parlance is called as Triveni. Here is a Triveni of services. Here is a Triveni of services and academics. And here is a real Triveni of services, academics, and research. God bless you all. I wish the entire team a very best for a meaningful, committed future in terms of their indulgences. And I'm sure that this very center and this very clinic will definitely make a mark in all these three domains in times to come. My good wishes and my blessings to all. Thank you very much for patient listening. God bless you all.
Thank you, sir. So